Welcome to the Consulting Leaders Podcast, where we talk about the business of consulting. Whether you're looking to grow your practice or learn from the stories of leaders in consulting, you're in the right place. I'm your host, Guillaume Jouvencel, ex-PwC and co-founder of GHA Marketing. Join me as I interview the best consultants in their niche. Let's get on with the show. Christian, welcome to Consulting Leaders. Happy to have you.
Having me. Looking forward to the conversation.
Well, let's jump into it. What pulled you into the fantastic, yes, stressful sometimes, world of consulting, Christian? What got you specifically in that and in digital health and telehealth?
I don't really recall, but it's been always this desire to launch something. I came across some books in 2002, Getting Started in Consulting and $1 Million Consulting, and that sounded really interesting. That I found in a bookstore, so I kept reading them and said, "Oh yeah, that's what I want to do when I grow up." But at the time, I was employed by the Mayo Clinic, a large academic medical centers with a lot of bureaucracy, a lot of layers, a lot of committee meetings, a lot of rules. And as a more kind of free-spirited kind of guy, I had great opportunities to learn, but also my opportunities to kind of unfold my wings were a little bit limited. And so then finally in 2012, 10 years after I picked up that book, I had the opportunity to shed myself of the golden handcuffs of a guaranteed pay increase and great benefits and jump into the exciting world of solo consulting with a first engagement that kept me gainfully employed and generated good revenue for the first 18 months. And then it was another plunge into drumming up my own business. The foray into digital health and telehealth is really that I'm a German engineer by background, training, education, and identity. Came to the US in 1998, 2 years before I joined the Mayo Clinic. And once I joined healthcare, I really found kind of my calling. I've always been fascinated about helping people to do their services in a better way. Ever since 1987, when I started developing software, I always liked to develop software for people who are delivering a service and help them for the technology to do it better. But the ultimate service delivery, I think there is healthcare. There's no better service delivery than that, really meaningfully speaking. And so I'm operating really, I look for the intersection of technology and healthcare delivery. And so that basically, so my engineering background and my passion for service delivery just made that a natural fit. Once I entered healthcare, the real challenge that I found is that most clinicians were stymied in their way to practice medicine by poorly configured technology or poor workflows surrounding that technology. And that is basically what for 13 years or 14 years coming up this spring, I have made my calling, is to help clinicians to get more value out of the digital health tools that are available to deliver extraordinary care.
So it's very rare that I get to talk to people who wanted to get into consulting in the first place. We usually fall into there by accident, but it's interesting. What's the problem that you solve now, Christian? What is it that you help people, companies achieve?
Healthcare, especially in the US, but I think all over the world, is dealing with a whole maelstrom of different challenges. It's an avalanche. It's the perfect storm. It has been the perfect storm for ever since I entered into consulting. We have a reduction in reimbursement. We have increasing cost for the care. That's because we are inventing all these innovative ways on how to cure diseases. And obviously we don't want to withhold that, but they're expensive, especially in the early stages. We have exacerbated by COVID a workforce shortage. We have a lot of burnout because of overworked clinicians, because of the burnout of having to work in 7 or 17 different systems and logging in and looking up here and there and following a paradigm that the clinicians maybe did not have in their mind when they wanted to use the technology. And so the core problem is that healthcare organizations want to use technology, but they oftentimes use technology in a way that is very disruptive to the clinicians. And so the problem that we solve is we help healthcare organizations to make the best use of digital health technologies by not focusing on the technology per se, but focusing on actually the workflows, the training, the support, the ongoing performance management, the ongoing continuous optimization of the workflows and the training and the technology. Because the technology is just the tip of the iceberg. It takes a whole another set of things to be in place in the system to do that. And so organizations engage us to help them assess their current telehealth setup, or digital health setup. They help us to design their strategies, and they help us to launch their services, their digitally enabled service.
What does that help us do? Why is that a problem? And what's the outcome of solving this?
Very good question. So technology should not be used just for technology's sake. But healthcare is very complex. And as one clinician one day, a clinician emeritus, or retired clinician, took me up to the top floor of one of the nice buildings of the Mayo Clinic and led me into the boardroom and said, "This is how I used to spend my time when I was dealing with the complex patients. I would take the medical file, which is Mayo Clinic actually invented 120 years ago, the first integrated medical record by basically having every specialist put their notes into one single file, not keep their own records in their own office." And so he then brought up this complete file of this patient with a 20, 30-year history, maybe even their parents or maybe their children, so the family members. And he laid it out on this like 50-foot boardroom table. And he looked at it and he studied it and he looked for test results and he looked for notes by his colleagues and by his own notes, trying to figure out what was going on with this particular patient. Again, that was a time before we had access to high resolution scans and other tests. And so the presentation of all the information, all the data for clinicians to make informed care decisions is really, I think, at the crux of, at the core of why clinicians need to have all the information at their fingertips. So that's the one aspect. The problem that telehealth specifically solves is that for most clinical visits, you don't really have to come into the office. And it wasn't always that way. It's been that way for the last 50, 60 years. You and I both share the European ancestry, and again, we have clinicians visiting the home even still now. I think in France, I heard there's doctors driving around in little cars compared to American cars, and they visit the patients. They do home visits, right? And in Denmark and in Sweden, we have nurses visiting patients in the evening to make sure they're all good. And so, and in the old days, actually, the father of the Mayo brothers used to go out on the buggy out onto the countryside and used to perform surgeries at the kitchen table or the dining table and just go around. And so we have kind of perverted the healthcare system, especially in the US, by forcing and expecting patients to come into the clinic when all that is really needed is a conversation to go over what's going on and then order some tests. And so video visits, one form of telemedicine, helps us to deliver better care to the patients, making it more convenient. You don't have to drive in. You don't have to go through the nasty magazines that are laying around there that are pretty boring anyway. And it just saves you time, and you can do that. And then there's elements of telehealth that we could go into, like remote physiological monitoring, where you kind of periodically just take vital signs just to see what's going on, to make sure that you don't end up in the ER. So why does it matter? It matters because it's all these tools, all these technologies are designed to help to deliver better care, to create better outcomes, to help clinicians make better care decisions, and ultimately to keep patients healthy, to make them healthy, and to keep them healthy.
Who is it that you help specifically? So is it healthcare companies? Is it the practitioners themselves? Ultimately, is the end patients. I was going to say end customer, but it's not a customer in this case, it's patients.
Mm-hmm.
But who is it that you help? Who do you work with directly?
Yeah, predominantly it's healthcare organizations. So it's the leaders in healthcare organizations that engage us to then work with the clinicians, to work with the nurses, to work with the operations managers, to work to some extent with the IT people. And so that's been the majority of our work has been focused on helping in the US. It's community health centers, it's rural health clinics, critical access hospitals, rural health systems with a hospital and an outpatient clinic. And then but then also over the years, I've been working with what I call entrepreneurially minded clinicians. So clinicians who are sick and tired of doing what they have been doing and have this entrepreneurial bug and want to launch a telehealth company or want to launch something. And so I've worked with about a dozen of them, looking to help them to define a business plan and the value proposition and figuring out what it actually would take. Most of the people, once they understand what it actually takes, give it that dream and go back to their $500,000 paycheck and say that that's actually a pretty good deal. But they had to check out whether the grass is greener on the other side. And then the third one is I've also worked with the companies as well. I've had a number of engagements with telemedicine companies, healthcare companies that wanted to improve their solution. And I've designed some backend user interfaces for the clinicians based on my work with clinicians. I've worked on some marketing plans, go-to-market strategies, things of that nature. But for the most part, we have focused on really helping organizations that deliver healthcare to do so in a better way.
So that's many. It's in the same industry, but that's many different avatars at the end of the day, target clients, right? How do you get into the room with those people, Christian? What has worked for you marketing wise to talk to the healthcare companies, to the entrepreneurial clinicians, to the people you end up working with? Like, what has worked for you to get them to knock on the door and be like, I'm interested?
Well, one of the reasons why I am working with so many different people is that I had to just take what came into the door, right? So it's so that it was opportunistically, right? Lot of for the first 8 years there was a telehealth resources directory that was run by a national association for telehealth in the US, and I bought a $2,000 ad per year in the consulting section. And so I can trace 80 to 9% during that time of my business coming from there. People were looking for the resource, they found me on that resource, and that's how they found me. Once they shut that down, then it was 18 months. The revenue completely dried up because I had not developed any other great marketing channels. Nor have I even in the last 7 years. And then COVID happened, but COVID was not kind of the blessing in disguise as I thought it could be in March and April. But through connections, through my network, I was connected with healthcare organizations who saw the need to do telehealth better than what they had figured out in the wake of COVID. And so that helped me over. And then predominantly we've had one client that we landed through my network. That has been our main client for the last 5-6 years. We've done over 100 projects for them because they have money, but then they give the money to healthcare organizations to pay us, so to speak, to help them. So that's that. But I've been on active on LinkedIn since the early days. I write a weekly article on LinkedIn for the last 6.5 years. I've got over 330 articles now on there. But I knew from the very beginning, my clients, my decision makers, my buyers are not on LinkedIn. They're not on LinkedIn. They're not on Facebook. They're not on any social media. They rarely hardly go to any events. And so my best marketing approach has been, and that is echoed by all the other solo consultants I've collaborated and worked with and networked with and masterminded with. It is networking, and it's staying in touch. One of my favorite mentors has taught me that the most successful consultants start with a target they can reach, study that group, and then develop solutions to the most costly, most pervasive, and most urgent problems. At the core of most failing consultancies is a solution that you want, and you're now struggling for clients who fit. And so I see ourselves, we're in the relationship business, and we never know what the next assignment is going to be. I think I've started listing these out. I've done maybe 150, 180 engagements, and I think it's over 140 different, or maybe 150 different types of engagements, right? So everything is custom, is bespoke, is really tailored to the unique needs of the organization. And as much as I would love my mailing list to generate business, or I've done 150 speaking engagements and podcast appearances, and maybe 2 or 3 have led to a connection that then led to a business. But for the most part, it's just I write, I show up, I network. So I'm working on 7, 8, 9 different channels, if you will, or marketing tactics, and then eventually something works.
How do you make sure that you stay in touch and develop that relationship-based marketing of yours and of a consulting business?
It's challenging. I think staying in touch means having people subscribed or on the list of my newsletter, or seeing that on LinkedIn. My mindset with LinkedIn, for example, has always been that this is where I find the referrers. This is, if a CEO wakes up on Monday morning and said, I need a telehealth expert, and so they ask the network, and then the network says, oh, there's this guy that posts on LinkedIn, maybe you should contact him, right? So that's one way to do it. The common wisdom, or the approach that works is, if you follow up with 5 people a week that could buy from you, right, or that would buy your services, that may have a problem that eventually you may solve. So they're in the same space and they're the decision makers. If you do 5 people a week, that's 250 a year. And so I have multiple attempts of a systematic process, and I'm finally getting there. That is run by an assistant that just basically identifies who do I need to contact next. The idea is to stay top of mind 3 to 4 times a year, not with a new service offering, not with a, hey, how's the weather, right? But maybe something of value, or saying, hey, I'm in town here. Do you want to grab a coffee? Or, hey, I just saw this article and was thinking of you, right? So it does take discipline, takes a little bit of work, but one could, right? And it doesn't have to be involved, right? People actually, I have to learn that people don't read emails that are longer than 2 sentences, especially not those that are buyers, right? And somebody just confirmed that 2 weeks ago. Said I read the first 2 sentences, and then I decide to delete, delegate, or do something about it. And so oftentimes I am much too verbose in my emails. I try to put in all the information so they can make an informed decision, but I have to realize that other people don't work that way. Anyway, so yeah, so it's the discipline of staying in touch, and it's all just a one topic email. It said, hey, what do you think about the new regulation that just came out? And they may not respond, but you stay top of mind. And then if 6 weeks later they have something that they need, oh yeah, I actually didn't respond to Christian. Let me just reach out to see if he can help us with that, right? So it's just we live in an incredibly busy world, and there's so much noise there, and but if you keep genuinely in mind of what can I offer to the other person that would be helpful to them, right? If you're giving, if you're paying forward, so to speak, or you're investing in the relationship by giving them something that they need, then eventually, in very circuitous ways, good will come around.
I think this is so good. I'm gonna double down on a few things here. So obviously the way we do this and we preach this podcast, but I genuinely believe that there are many ways to go about that. You need four things as a consultant or consulting firm owner to grow. And again, that's assuming that you want to grow, right? If you're at the level that you're satisfied with and you get mainly business through referrals and that's fine by you, then congratulations, you've won. And I mean it. Like, this is, at the end of the day, it all depends on the goal and then reverse engineering this. When you want to grow, you need four things as a consultant. You need authority, so expertise, being perceived as an SME. Like, when you say, hey, you should do this to improve the situation, people take action, get positive results, that's authority. You need trust, so ideally you reinforce authority by showing, hey, I've helped that many people exactly like you, exactly in your same situation. You can trust that I will help you achieve, maybe not promising on results, but at least promising on, hey, I'm going to do exactly the same thing for you that I did for those other 10 people that have obtained this type of results. Then you need visibility. But this is what I think most consultants get wrong. They want vanity metrics, or they think they want vanity metrics, as many likes as possible on LinkedIn, as many views, as many impressions, whilst what matters is exactly what you said, Christian. It's a few targeted people who are the decision makers and the right people. 5 a week. I like that mentor of yours. I think it's like spot on. How do you get consistent touch points with actual decision makers that matter? You don't care about the rest. Visibility in front of the right people. And then it's sparking a conversation. It's like starting a conversation with someone who has a problem you can fix and who has the means to pay you eventually. And that's, hey, I'm in town. Let's do coffee. Hey, have you seen this article? I like the process a lot. Again, no matter what channel you decide to go for, and multiple channels can work, as long as you cover those four, you're going to get business. And then it's a matter of how much volume, what works best for you, what's the best setup for you. If you're in a local area where you can meet a lot of people in person, obviously that's what you should do. If you're European like me and in Europe, you want to find a digital way to do this, whatever you decide doing, building those relationships, having the visibility in front of the right people, and making sure that whatever you do, you optimize either for trust and or authority, you're going to grow business.
Yeah.
Talk to me about retention, Christian. How do you, once you get that engagement, how do you make sure that this transforms into another engagement with the same client, whilst keep on providing value, making sure that they get tons of value from you, and you still make money from the same clients? How do you do that?
Well, first of all, my mindset is not to make money from the same client, but is to use my talent to create more value for my client, right? So again, we need to watch the language, and I'm sorry for calling you out on that, but that's the trap I've fallen into as well, right? I want to make more. No, really, you got to train yourself to say, how can I create more value for my client, right? And then money will follow. But I totally understand where you're coming from. That's where I recognized it, because I still have that language swirling around my head, and I'm trying to catch it early on so that it doesn't come out, because it's all about kind of right setup thinking. A couple of ways here. So first off, you have to do a great job of doing so. The second one, we start a retrospective process about 2/3 into the engagements, where we're first off starting to say, hey, the scope of our work is defined by these desired outcomes. That's something else we do very differently than many other people. We don't have hourly or daily rates. It's all fixed fee, fixed scope. And it's not based on deliverables. It's based on outcomes, based on desired outcomes. And so we started the conversation, hey, we're almost done here with the project. Here's what we've accomplished. If we do these 3 more things, will this satisfy what you were expecting, right? So this is just helping them to realize the value that we're creating. Oftentimes people need to be reminded to actually see the value. Then we do a retrospective. What worked well? What could have gone better? Where could we learn from? And also what was really valuable to you, so we don't throw it out in the next iteration of our continuous improvement. And then I set up with most leaders, I set up monthly meetings or bi-monthly or quarterly meetings after the engagement. I said, hey, it was fun to work with you. I really enjoy I mean, you have a lot of challenges. Would it be valuable to you if we meet once a month or every other month for half an hour to just chat? Right. And so I just stay top of mind. I have had multiple leaders. A lot of CEOs are lonely because they're surrounded by their team and everything. And there are certain things they cannot share with a team, and so talking with somebody else who's seen some other things and some other things is very valuable. And it's all relationship building. This is not about finding the next engagement. It's staying top of mind. And it's building out my intelligence of really learning what these leaders are, what the challenges they're dealing with. And if I hear about a problem that they're experiencing, then I may say, hey, would you be interested in a separate conversation where I can think about some things on how we can solve that problem for you? And usually they would say yes. And so we call them economic buyer meetings. And I track them as well, staying in touch with them. So that's a good way. The other thing is internally in our leadership team, we have a weekly leadership team meeting, which actually is coming up in half an hour. And what we're doing there is every other week. So that means about 24 times a year. We will take one client and we'll step back and take a look at the bigger picture. What are they up to? What are the challenges? What are they dealing with? Where they're coming from, why did they engage us? So just spend 10, 15 minutes to just talk amongst ourselves, the consulting team and others who are not involved with the client, to just study, to understand where this client is coming from, what they're dealing with, just to deepen our understanding. That oftentimes doesn't lead to anything other than a better understanding or appreciation. But sometimes it does lead to say, oh yeah, let me ask them if they're interested in that. And so that is, it's another way how to behind the scenes kind of really make those. Because yes, I had to realize that business development, or as I call it, opportunity creation, has two parts to it. It's nurturing clients and it's nurturing leads to win engagements. Right? So that's my definition of opportunity creation. And I'm more prone to meeting new people because I like to meet new people and get to know them. And so I had to discipline myself to create a systematic process, create a habit, if you will, to make sure that I don't just forget about my current clients because I'm so excited to meet new people. And so that's what it takes. But yeah, as you see, a multi-pronged approach, very mindful, very purposeful, intentional approach to make sure that we are looking for opportunities where we can create value for our client.
I like the philosophy a lot. I think that's how you retain by providing more value.
Yes.
I like the approach. What's your number one challenge right now, Christian? What's the one nut that you're trying to crack that once you're gonna crack, you're gonna take the whole thing to the next level? What would that be for you?
It is finding that business development facet, right? So I've been romantically desiring, I think like everybody in our position, that there's a faucet we can turn on and we get the business we want, and then we can put it to a dribble, and then we can turn it down. And I'm just beginning to realize that that may not exist, or that I may actually have it. Right? I am networking. I'm following up with people. I'm connecting with people, and those things eventually do pay dividends. It's not as direct as we would like it, and you just got to show up every day, and you just got to put in the good work. But yes, the challenge is to really generate a predictable stream of leads and then ultimately engagements. Right? My personal challenge here for my small team is that we've received 80-90% of our revenue in the last 5 years from one client. And I've identified that as a risk 4 years ago. And I have had enough time and money set aside so I can focus on marketing and business development. And so none of these excuses that we usually use apply, but I was not always heads down in the delivery side. But I've identified that at a risk. I've made a huge investment in another mentor to help me to identify how to break out of that. And it's just challenging. And I'd like to tell myself the excuse that healthcare is just very difficult. But I guess every guest on your show will say that my industry is special and difficult. And the grass always does look greener on the other side. And so yeah, I mean, that's really the biggest thing. And that then also brings with it the challenge of how do I scale my delivery team and maintain the same quality that I would do if I was involved. So unlike also many other consulting operators, I do enjoy the marketing and business and networking aspects of the business. I do enjoy kicking off projects and designing the approach. I get less enthused and excited about the actual delivery work that I got to team up with other people. And so, but then the challenge is, and we've encountered that a few times over the last 3 years, how do we grow it into a boutique consulting firm that maintains good quality just because our engagements are not cookie cutter, follow this process, and you'll be happy. It's not just standard analysis or any of that matter. And so that's the challenge. That's the other challenge that is doing that. And I don't know how much time we have to go into this, but and then there's a huge opportunity. There's $50 billion right now on the line that's being invested in rural health in the US. I would venture to guess that 30 billion of that is going to flow into digitally enabled care in one way or the other. And so with us as implementation experts with 90% of our expertise or experience in rural, I am perfectly positioned. And so if this is not it, then I don't know, I go back to maybe I'll work at McDonald's because I've never worked at McDonald's, and maybe I'll flip burgers so I can say I can have flip burgers. So but yeah, I mean, so that is the other thing, is like, how do we position ourselves for the opportunities that are coming up, which are going to be very, very, very RFP driven, very state driven. And then all my experience in relationship building is out the door, because you cannot build relationships with a procurement officer at a state level that is just looking at the scoring. And so that is the other challenge that is definitely and literally keeping me up at night or busy over the weekend.
Exciting opportunities when there is that much money flowing. But the other, I mean, it's always a double-edged sword, right? It's always going to be, okay, there is this opportunity, and obviously a lot of people are going to look into this opportunity as well. But it's better when there is money. To the thing around healthcare is complex. I think, so you're right in the sense of as a consultant, you need to solve, I think, you need to solve one problem, which is hiring, training, and retaining the best talents so that you can hand over the delivery without diminishing the quality, which is when you look at the biggest consulting firm, this is all they are. Like, they are machines at recruiting and then building that pyramid model where, the promise of becoming a partner within 15 to 20 years. Once you've solved this, and it's a chicken and egg, how do you get sustainable demand through the door to give work to all these talent, or vice versa? I think that's always going to be the challenge, especially with high ticket, especially when authority and trust are so important, and yet we are in a world where anybody can claim anything on the internet nowadays. Mm-hmm. Finding that sustainable leads pipeline is, it's a challenge that I don't think is proper to healthcare specifically, but I see how, especially with high stakes like this, where reputation for the client is even more important, especially in healthcare, I see how that can be an interesting challenge to solve, but that's also why we get rewarded so much money.
Yeah. I think in healthcare, the trust part is actually probably the highest, more so than authority, right? So people will rather spend $2 million on McKinsey than spending $500,000 on Ingenium, even though we could do a better job in doing so. But
That's
if they hire McKinsey and McKinsey fails or just delivers fluff with an army of milk-faced MBAs, no offense to any, right? Then
not taken.
No, but you know what I'm saying, right? They have this,
Yeah,
as you said, they have this army of people that don't really know what they're doing, and they're being tasked with all these things, and so then they create a lot of fluff that is not actionable. Whereas we are focused on building the trusting relationships with the client and being in touch with them. And so, but yeah, a health system would rather spend $2 million on McKinsey, and then if that fails, then the board is going to say, well, at least you hired McKinsey, so I guess it was a difficult problem. But if they hired Ingenium and it fails, which it may not, but that's not a risk they want to take. So that trust, right? That trust component is really deep. And so, yeah, and you only earn that through networking. I mean, my visibility building part is my newsletter, and that's my authority as well. So, because if any question you have about digital health or telehealth, I have an article on that. And if not, it's in your inbox next Tuesday because I write on command. In the conversations that I have during the week, sometimes I turn it into an article. So I've got the authority, I've got the visibility, at least to the extent that I can get it, and the trust. The trust is that's referrals. I just got a lead yesterday because the CEO of a health system is singing our praises by having helped them for free because the money came from somewhere else again. But she has a lot of colleagues reaching out to her. We need some help. And now she's referring us. And I think, and I've always had somebody who is responsible for the majority, like 60-70% of the business that's coming in. Somebody in my network that has some other job that is doing that. And the other thing I wanted to add, we can hustle as much as we want. We can be clever, we can be good, we can be diligent, we can do really, really great work, and we hustle and we hustle and hustle. But success is not just dependent on the hustle. There's also a key element of timing or luck. And we just don't know what's going to work. And so you just got to put in a good days, good weeks, good months worth of work. And things will come back, but it may take off and suddenly I'm a $10 million consulting firm, or it may just stay here. And it's just the lack of the timing and the connections and sometimes the follow through. And so that's what I'm living nowadays is I don't want to look back with regret to this day. I don't want to say I didn't try. So at least I can say I tried and it didn't work. And then it's not my fault. It was just, it was just not meant to be, or it was just not the timing was not right, or I didn't have the right connections. But I'm constantly learning, optimizing, iterating to find the best way so that I cannot fault myself for at least not trying.
Christian Milaster, ladies and gentlemen. Christian, if people want to find out more about you, see what you do, where should they go?
LinkedIn is the best way here to connect with my consulting friends. I've always loved or have always been in networks with other consultants. So if you're experiencing the same problems, if you're in healthcare, please reach out to me, Christian Milaster, Milaster, on LinkedIn. And you can also find my website on ingeniumdigitalhealth.com.
We will put all the links in the description. Christian, thank you so much for coming on Consulting Leaders.
Thank you for the great questions. It was interesting to dive back in.
Thanks for joining us on this episode of the Consulting Leaders podcast. We hope you learned valuable lessons on how to grow your practice and take your business to the next level. Make sure to subscribe and leave us a review wherever you're listening to this show so you never miss an episode. To apply and be a guest on the show, click the link in the description. See you next time.
How